through for you?
Yes, thank you.
Okay, can we move swiftly on to Gemma, who's going to tell you about use in her pharmacy programme. Thank you.
So yeah, my name's Gemma Quinn. I'm going to cover quite a lot of the similar sorts of things that Andrew's just covered, but we've taken a slightly different approach. We don't have iPads, so we are doing similar things but without iPads. So hopefully we can give you some tips about that. So I run a postgraduate diploma in clinical pharmacy for hospital pharmacists at Bradford. So that's what my background is. So I'm going to start by saying what we need, what was the point, why we redesigned the whole course, why did we do that, and what did we want to get out of it. I need to give you a brief bit of background about the general level framework, which is the competency framework we use. Talk about our course requirements, and then discuss why we decided to use PebblePad. So we designed the course first, and then looked at PebblePad. And then hopefully some tips to help you to learn from mistakes that we made. So this redesign was in place from January 2011, and I think we've just cracked it this time. So hopefully you can learn from all of my mistakes and benefit from them. So our clinical diploma is used by almost all the hospitals in the Yorkshire region. It's for newly qualified pharmacists, so they are qualified, they're graduated, they're working in hospitals as pharmacists. Part of their employment contract is that they have to do the diploma. So when they start work as a junior pharmacist, they know they've got 2 years of a clinical diploma. In one way that's good because they have to do it. In another way, they're forced to do it, so levels of motivation are variable. Generally quite good though, because generally it's the creme de la creme who get hospital pharmacist jobs. They have to have a diploma in order to move to band 7. Sorry, that's a... I just know about their interview techniques, that's all. They have to, in order to progress from a junior pharmacist up the ladder, they have to have a diploma, so they have to complete it. And the hospital support that. They release the pharmacists 1 day a month to come to the trust, the university for teaching, and they also allow them to have teaching time within the trust. So we're really well supported by hospitals in the region. So this is our region. So we have students coming from Scarborough, Sheffield, Hull, to Bradford. So they're doing 85 miles to come to Bradford, some of them. So we can't possibly go out and assess all these students in their hospital. We have about 70 students on our diploma, so it's a huge amount of students over a very large area. Okay, so when I arrived at Bradford, the course basically hadn't been touched, I don't think, since about the 1980s, and it needed a complete redesign. So we got all the stakeholders together and asked them what they wanted. And their main issue with the diploma that was already running was that it was very knowledge-based and the students didn't integrate that knowledge into their practice. So they might come to a paediatric study day at the university. That doesn't mean they're going to be able to do anything with paediatrics when they get back to the hospital. So we really needed to make sure that these students could integrate knowledge and practice. They needed to be able to work in a team. Pharmacists have to be able to work with doctors, nurses, obviously talk to patients. So we needed to make sure they could do that. They need to make effective use of resources. Pharmacists normally have about an hour on a ward a day to sort it all out. And they also need to be able to manage their own time and think independently. So that's what we decided we needed for a good junior pharmacist. So just teaching knowledge wasn't good enough. So we looked at the competency framework, which is the general level framework. So this is a validated competency framework for junior pharmacists. It's been shown to accelerate and sustain their development. And all the pharmacy organisations basically in the country support the general level framework. It's changed slightly now, but this was the situation at the time. There's now an updated version of this framework. But the main issue with this framework is that it has 101 competencies. So that's quite a big competency framework and was quite a big chunk of work to take on. And they're divided into 4 clusters. And as you can probably tell, those 4 clusters match really closely with what we wanted our graduates to have. So it seemed like the perfect thing to use, if somewhat huge and scary. So this is what it looks like. Each student can be graded. So for example, if they use appropriate questioning to obtain relevant information, they either do that consistently, usually, sometimes, or rarely. And that's what we wanted to know. Were these students at the right level and were they doing the right things? So the first thing we did was we made the GLF a pass-fail component of both of our big clinical modules. So we knew that if the pharmacists weren't at the right level, they couldn't pass the course. So that's quite a big incentive there for them. But that meant we had to find a way to assess those competencies. And the way we used that was we used these validated assessment tools that are used in medicine. Some of you may have seen these before. They're also used in pharmacy. So CODEG, one of the pharmacy organisations, have released these for open access to everybody. So the students have to complete in the year a certain number of mini KEXs, a certain number of case-based discussions, and a certain number of patient consultations that they're observed and assessed. So we embedded that into our portfolio, and that's what the students were having to do, along with various other tasks, including a 360-degree assessment and some other pharmaceutical care plans, etc. So this was quite a huge thing, and a big change for students that they were going to have to start to demonstrate this competency framework. So how do we use it? The students complete assessments throughout the year, and they use those assessments as evidence for where they are on a competency framework. They also have a syllabus they have to cover of clinical topics. So at the end of the year, they have to be able to show that they've done all of the assessments, that they've met the right level on the framework, and they've also covered the correct clinical topics. And then they use all of this as evidence. So they then sit down with their practice tutors who meet with the students and discuss where they are on the framework and are they at the right level. So first year students have a particular level of each competency they need to be at, and second years have a particular level they need to be at. So the practice tutors meet with the students once a month. They identify the areas of the competency framework that the student needs to improve on, and then they set objectives for the next month about what's the student going to do in that next month. For the first year, it's 3 times a year. For the second year, it's twice, because we need a baseline for the first year. They have a really big meeting, which takes about 2 hours, where they sit and look at all 101 competencies and assesses each student where they are. They love those meetings. But the idea is that the student self-assesses and hopefully turns up to the meeting and says, I think I do this sometimes. I've got a mini KEX to show this, a case-based discussion and a pharmaceutical care plan. The next competency, I think I do often, etc. And they present that evidence. And as I said, they've got required standards that they must meet by the end of the year. If they don't meet those standards, they don't pass the course. Okay, so this is a version of a paper copy of the form that we used. So this is a mini KEX. So you can see there's lots of tick boxes, areas to highlight things that are good. You've probably seen forms, all sorts of forms like this before. And all the forms we used are of a similar format. This is just an example of this is what our first years have to include in their portfolio. So you can see it's quite big, quite complex. There's quite a lot of work they have to put in. So I was starting to get a bit terrified about how I was going to actually assess all of these. So I had this vision, because before we started this course, we had paper portfolios in my office, just full of paper folders. So I needed to be able to manage all these different pieces of assessment for all these different students in this huge area. So PebblePad was really the only way to do it. We already used PebblePad at our university, so we had access to it. I'd used it for undergraduate pharmacy, so it was fairly obvious to me that this was the obvious way to do it. So we now have a nice online mini KEX. So most of you may have seen this, but the student fills in their name and their UB number, and then the assessor, these are assessor-only fields. So as you said before, they go on, they click where they think the student is, and they fill in their form. Very, very straightforward. And it's also nice for us because we can see afterwards who's filled it in and when they filled it in. So we can check that, yeah, it's one of our, someone who we know has filled it, someone who we know has filled it in. So we can track back who's done the assessments. So just to show you again, the ones that are starred, they're the ones that we've got forms for on PebblePad now. So we've managed to create forms for virtually everything we need on these portfolios, and we use those as templates. So that's made our life a lot easier. Okay, so I think I've probably covered that. The tutor has their own access. PebblePad recognises them as a tutor, and therefore they can fill in the assessor-only fields on the forms. We can audit it all backwards at the end. We can see who's filled in what and when it's been completed, etc. Okay, this is an example of a portfolio. So you can see there's several different pages. Lots of different pages on our portfolio. They're big, but they look quite nice. They're quite easy to navigate. So when we first started, the students did all these forms separately, and then at the end of the year, they pulled it together into a portfolio. And that was where the nightmare began. So we don't do that anymore because we now have workbooks. So that's what it looks like. And this is just an example of how of the forms that the tutors fill in to assess, to tell us how many competencies they've assessed and what evidence they've reviewed. So they tell us how many mini-KEXs they've looked at, how many case-based discussions, and how many competencies they think the students got left to achieve by the end of the year. Okay, so how can you learn from our mistakes? So, when we started, we had all these separate forms as separate forms, and the students had to submit them as separate assignments. I ended up with probably 2 or 3 pages, screens full of assignments on my assignment list, which was just impossible to manage. You couldn't keep track of what was playing, what was stopped. It was a nightmare. So that was our first problem. We found students often submitted incomplete web folios. So despite the fact they had a whole list of things that they needed to include, they would still submit the wrong things, or not submit the right number of things, or duplicate submit things. We also found that students at the end of the year had a mad panic. They were trying to put their portfolios together, they would be ringing us, and their submission date is the 5th of January normally, so that's over Christmas, when the students are really panicking, which is not great for the students, and it's also not great for us when we look at our emails and see we've got 15 students emailing us about portfolios. So that took quite a lot of work to manage, and also the students and tutors struggled with that system as it was, with all these different submissions. I think the next screen just gives you an example. So this is not even the full screen of assignments, but these were some of the assignments that we had, just to give you an example really of how difficult it was to manage. Okay, so then we had the advent of the workbook, and this has changed everything for us, hopefully. I say hopefully, it seems to have done it in a minute. So we created a workbook for these students, which has got all the forms in it already. So they literally just click on, fill the forms in the same way, but they only have to use one workbook for the whole year. So at the beginning of the year, they get their workbook, they submit it, and they just build it throughout the year. And we've also used nested workbooks, so I don't know if people use those already, but say for example our mini-KEX forms, we've got 7 mini-KEXs, that's a separate workbook, so we can embed it in different years of the course. So, what are the advantages of a workbook for us? We only need one assignment, so we don't need all these hundreds of assignments. The students just submit a workbook, and that's it, one assignment. It's all in one place, it's easy to find. The workbooks are set to auto-submit, so the student doesn't even have to submit them, because that was another issue, that students would create this web folio but not realise they actually had to click on submit, which is a bit unfortunate for them really. The student builds it throughout the year, so they don't have this mad panic at the end of the year to build a portfolio. And also I hope that they might start to see it as being more developmental. It's not something that they're working towards at the end of the year, they're building it as they go through the year. And we've put in some extra workshops to help them to start thinking of it like that. We can track progress in real time, so I think the next screen shows how we report, and so we can see how many students have done what. Students can mark pages as complete, so they get a nice little tick box and says your workbook is such and such % complete, so they get a nice feeling that they're actually getting somewhere. We did have an issue when we first released the workbooks that we found, obviously as you always do, no matter how many times you check, some errors on the template. If you make a change on the template, that filters through to the workbooks, so you can amend those in retrospect, which was very useful for us. And those nested workbooks that I talked about have also been a bit of a game changer for us. Okay, so this is just an example of how we track the workbook. So at the top is where the students click to say it's a complete page or not. And then here's an example, so we can see here that we can see how many students have done their first mini-KEX, and there's 22 have done it so far. So out of 34, we know that 22 students have done their mini-KEX. And we can also click on show users, and we can see their names, so we can identify who hasn't done a mini-KEX yet, send them a quick email and say, are you okay? You're halfway through the year and you haven't done a mini-KEX. So they're really useful with workbooks. Okay. So it wouldn't be fair to talk about workbooks without talking about the disadvantages. They are, especially the first time you do them, quite time-consuming to create. I didn't find them particularly intuitive, but once you know how to do it, it seems intuitive, if that makes sense. It's easy once you know how. And it's a different approach again. So having trained students how to use web folios and the tutors how to use web folios and how to submit, we've now had to go back and say, actually, forget all that, we're doing it like this now. Now actually, it's easier, so hopefully it won't be a problem, but we have had to do that we did get numerous emails about, oh, I can't submit this, and the view edit thing that Andrew mentioned is definitely an issue. So if students want to edit, they have to click on edit, otherwise the tutors can't see changes. We produced quite a good troubleshooting document that said if this happens, do this, if this happens, do that, and that seemed to deal with a lot of the problems. We only introduced this in January this year, so we don't actually know what the students think yet, but we haven't had any moans about it, and we did used to have quite a lot of moans about it before. We think they prefer it. For us, it's completely different. It's made the management of PebblePad and these portfolios so much easier. I can't think of any complaint anybody could have that would say these workbooks are more difficult than the previous system. It's not conceivable. Okay, the other thing just to mention that I think will also be a big changer for us is the issue of usernames. So we currently, our mentors in all the different hospitals are registered with the University of Bradford username. That means we have to go through IT to get that username. Only IT can deal with any queries about that username. The people also get access then to email, the library, Blackboard, everything else that they get, which means the university is a bit twitchy about how long they let them have accounts for. They automatically expire after 2 years. It's a nightmare. We can actually now, we're going to start directing our tutors directly on PebblePad, so they just have their own username only for PebblePad. They can't get access to anything else, so it doesn't cause issues for the university. We're not using their IT system at all. It also means we can sort out the problems because we can see what's going on rather than having to go backwards and forwards between IT. So hopefully that's going to be a bit of a big game changer, because again, we have hospital tutors have to change their usernames and passwords about every 5 minutes, as far as I can tell, within the hospital. So they don't have one username, one password that they can use constantly. So they always forget their passwords, especially if they're not doing assessments very regularly. So I'm hoping that this is going to save me a lot of time. Okay, so have we cracked it? I'm really hoping that we have now. It's taken a lot of work to get there, but I think the systems now are much smoother, much more smooth, and I think they'll work much better. So hopefully some of the tips that I've been able to give you you can take away, and you can not make the same mistakes that I made and have to find the workaround. Okay, so just to summarise, we needed a course that produced competent clinical pharmacists, not ones that could just regurgitate information in doses. So we introduced the general level framework and a suite of assessment tools. We've been able to use the experts. So the hospital tutors are the experts. They're the ones who need to be doing these assessments, not us. And that's what we've been able to do. We've been able to keep track of students' progress so we can see how they're doing and pick up the students who are really struggling. And the other really great thing with this is that the students then have an e-portfolio to take away with them. So certainly I know hospitals who are saying, right, bring your PebblePad portfolio with you. We want to look at it in your interview. And we have students who are going elsewhere saying, how do I show this? How can I use it? So it's really, really great. And with pharmacy at the moment, once students have done this general level framework, there is now an advanced level framework. So they're going to be doing this their whole career. So actually, if they've got a PebblePad account, they can then build their own stuff later on to show the advanced level frameworks as well. There have been many challenges. So if you're going to do it, just beware of that. And as we said, it's not just click a button and it all works, but it's much easier than trying to wade through 70 paper portfolios. We also use PebblePad on our undergraduate capability module, which looks at similar sorts of competencies, and we're about to roll out workbooks for them next year as well. So hopefully that will make life easier for those as well. So that was all I had to say. Does anybody have any questions?
Just a technical question on the tracker function.
Yeah.
Is that something that's available within PebblePad, or is it? I've not noticed that.
I think when you create a workbook, you can ask for it to be tracked. So you can set it to be a tracked workbook when you first create it.
What's that feature exactly do?
It helps you to see how far they are through the workbook.
Like a percentage?
Yeah. Yeah.
Can you run reports on that?
Yeah, now I'm not sure that the reports are linked. I think you might be able to run reports even without the tracker.
Yeah.
But yeah, you can run reports. So on a workbook, as I can look at all of those different forms and tell who's filled it in. So they have to do a learning contract, how many have done it.
Is it like a tracker for the whole workbook, or the individual templates as well?
Well, I think there's the tracker at the bottom is for the whole workbook for the students. So they get an individual, you are this far along the workbook, so you've completed 75%. And then the reports look at the templates individually.
Okay.
Yeah.
Okay.
Have you had any problems with testing it, we had a few cases where we were getting 140% complete. Because we've got nested workbooks and things.
No one's told me they've completed more than 100%, but I don't know, to be honest. I'll keep my eye out for that. I've not had a problem yet, but I don't know how much the students are actually taking any notice of that. And we're more interested in the assignments and the templates, so we don't really, it doesn't matter to me what percent is completed. I want to know, have they done, how many mini keks have they done, etc. So I don't look at what that tracker says. But
So you set up something very similar with the nested workbooks, and we wanted to use the tracker function.
It doesn't
just
work.
couldn't get it working.
right, that's
Might have a
interesting.
chat with you.
Yeah.
Just had two questions. How do you deal with the 360 feedback in terms of getting, because if you want to set up a PebblePad account you need a license, but as part of 360 feedback you might have to go to other colleagues, patients. How did you deal with that? That was one question. My second one was, how do tutors or preceptors give feedback for the assessments? Is it using a feedback tool or is there something else?
Okay, I'm going to forget what your first question
It
was.
was about 360.
Yeah, so we actually, the 360, we use a survey tool, so we don't use PebblePad for our 360, they just submit a form with their contacts on.
Okay.
We then create them as their own survey and we email the contacts a link that they click on. So we use it to collect the names of the people who they want and their email addresses, but we don't use it to, as far as I know, we can't use it to collate 360 degree.
And it's translated back into PebblePad?
Well, we send it to the students as a PDF. These are your results, and we expect them to then upload it into PebblePad. And what was your second question?
About how do tutors give feedback on assessments? Is it through that feedback section of it, or? No,
it's all on the forms. So because we don't have the iPads, which would be brilliant, and again we have the same issues as you have with Wi-Fi and access to computers in the NHS. So most of our assessments are done on, the tutors go and watch them on paper and then they sit down with them to give them their feedback and put it onto PebblePad as they give them their feedback. So they just click the buttons and the whole form kind of has areas for work, areas of good practice, areas to work on, etc. So the feedback all goes into that form.
So you're not using Atlas for the feedback, you're using an experience template or something like that?
It's in the mini keks, for example, is a form that only the assessors can complete.
So we'll know, so they still go through Atlas?
They do have to go to Atlas to access the students' work, so they can get the students' workbook through Atlas. They open up the students' workbook and then they can add in their feedback into the form.
Just from the content of that, I'm guessing it might be a bit early for you to answer this question. I'm kind of wondering if the fact that you've got a workbook that's so kind of well integrated, if that kind of works better as an assessment portfolio, but if it's got a kind of downside in terms of the students taking their own portfolio on afterwards, and if you've got any early sense of where
Well, I haven't really, but I have thought about that, and I did think, because we actually say, they have to do a minimum of 7 mini keks, a minimum of 3, and that's what's in the workbook. At the minute, that it would be quite difficult for a student to do extra ones. So that's one of the things I've been mulling over, that next year I probably need to put in more than they've actually got to do. So put in 10, for example. But you're right, so they wouldn't be able to use that workbook to go on and develop later on. They'd have to create their own web folios then. But I guess hopefully you've given them the tools. It's kind of a nice gentle introduction. Okay, we'll start by giving you a template and a book. When you're on your own, you can pull it together.
It's tricky though, isn't it? Because all those difficulties you mentioned about students having to get used to the idea that they've got individual assets that they're pulling together themselves, they're all things that if they are going to have the skills to be able to keep using it for ongoing CPD and so on, I can see how the workbook might be great for their first post application after finishing it, but it might then make it more difficult for them to actually see it as something they can control and build on and keep using.
Yeah, and I do, because part of the thing obviously is that once they leave us, they're not going to have access to those workbooks anymore. They won't have access to the mini kekses or the case-based discussions or those forms. So this is where it goes back to, if the regulators were starting to use PebblePad, that would make it a lot easier, because these are all recognised they're used by the Royal Pharmaceutical Society as assessments. If they used PebblePad and students could easily get access to those kind of open tools, that would make life a lot easier. But because at the minute it's just for our students on our course, once they leave.
One of practical level, do you take them through sort of uncoupling pages from the workbook or, you know, anything like that?
Well, I haven't done yet, but they haven't finished yet. So that's something that I probably need to think about doing. That at the end is to give them something about right now. What do you do with this now?
I mean, I guess if you find out that only a tiny percentage are actually activating their alumni accounts anyway, maybe it's not a huge issue and it needs to just be an assessment portfolio.
I think
we've got this.
It'd be good to have. It would encourage them, wouldn't it? If we could do it, that would be nice. Yeah. So I'll take that away. Thank you.
I was just going to add as well, it's quite interesting that some of the surrounding trusts have taken it on, and it's not just been nursing and midwifery. People have said, our pharmacy students use it.
Yeah.
And they're sort of keen for them to continue to use that for the development. So maybe it's just sort of a transitional in the training.
And there's two things as well with us. So firstly it was PebblePad, but also the general level framework for some people was completely new. So I was kind of going to do the training going, has anybody heard of the GLF? And kind of getting these blank faces. So I've had to train people on both the GLF and PebblePad. But we have found that now, so all the tutors know about the general level framework because they're all assessing it against it all the time. And they're all now much more familiar with going on to do this advanced level framework themselves. So I think it's actually had a really good impact on the whole pharmacy workforce because now they all know what the GLF is. The juniors have all got the GLF to a certain stage and the seniors are starting to think about, right, well, these are what our junior pharmacists are going to do. They're going to be coming up behind me. I need to get my act together and start doing some of these frameworks myself.